Hi, I'm still welcome back. So today I want to talk about acute kidney injuries. So previous video I did mention about the renal system disorder. Now I want to talk about acute kidney injuries. It's another renal system disorder, but it's a short term and a separate topic because it has important information linked to the risk factor and how it develops. So this presentation explain the definition of acute kidney injury, the etiology, how it developed, like the root cause, symptoms, risk factors, pathophysiology, diagnosis, treatments, options, and how to prevent acute kidney injuries. So the definition of acute kidney injuries, according to Kidney Foundation Australia, define it as a short-term loss of kidney function. It can be completely recovered, partially cured, or leading to permanent kidney damage. So it's three different health outcomes. So it can completely recover, which means completely cure, or partially cure, like 50% recover and 50% require ongoing care, or lead to permanent kidney damage, which means 100% cannot recover. So it affects the kidney function, the kidney and urinary tract. The root cause, the etiologies of acute kidney injury linked to medication. So when we use some medications, it can develop acute kidney injuries or damage to the kidney, blockage when where something blocked the urinary tract, like kidney stones, surgical procedure that affects the kidney function, spot injuries. So here, spot injuries. So there's damage to the kidney, and obstruction, like urinary obstructions. There are risk factors influencing acute kidney injuries, and this risk factor including severe infections to the urinary tract, radioactive dye. This usually forms a contrast dye of the X-ray procedure or any incision procedure methods that insert in the dye, and the radioactive, it's usually an X-ray dye. So these can develop acute kidney injuries, a damage to the kidney. Kidney stones can obstruct the urinary tract, urinary pave. Prostate enlargement, again, can develop into prostate cancer. Dehydration from surgery. So usually in post-surgical procedure, the patients might be dehydrated, the loss of blood and water. So dehydration and cannot prevent if there's no sodium chloride administration to prevent dehydration in post-surgical procedure or post-operative, then the risk of renal damage is high. Spot injuries. So those who have injuries and affects by the kidney damage because playing sport, and comorbid with diabetes and hypertension, similar to chronic kidney injuries. And the symptoms here, you can observe when sharp increasing of creatinine and toxin in the blood when after doing the blood test. Then edema will appear to the knee, hands, ankles, and feet. So you will observe by swelling to the knee, hands, ankles, and feet. So edema when fluid builds up, and low urine output and incontinence. So patient may have low urine output. The pathophysiologies of acute kidney injuries involves hypertension, which means when the blood volume pressures drop, causing kidney to be hyperperfusion, leading to the damage of tubular. Usually the strong antibiotic side effect can damage the tubular, or the contrast dye of X-ray damage to tubular or radioactive dye, and the blood vessels are vasoconstricted due to inflammatory response at the endothelial tissue to release high cytokine, which is a chemical protein that can then leak into urine, causing cloudy urination at any chance. These chemical protein release leak into urine and vasoconstrictions results in the temporarily kidney injuries. So it damages the kidney, but short term for temporary. And in addition to kidney stones or tumor cells or prostate enlargement, when people get older, they can cause obstruction and urethral compressions, causing low urine output. Then these elevate Bowman's capsule pressure, the Bowman's capsule pressure. So again, people may try to pee hard and still have low urine output, and then leads to interstitial inflammation. So because the urine still remain inside the kidney because of it's been damaged for a short term, then it can cause inflammation inside. That's when the bacteria can develop, and it affects development to acute kidney injury. So what are the diagnoses of acute kidney injuries? Include renal ultrasound to capture the image of the kidney and the shape and size, blood test, check for serum creatinine, check for C-reactive protein or ESR, so check for infection inflammation rate, check for sign of anemia, and your urine test. So not just blood test, we also do the urine test to check for acute kidney injuries, check for protein inside the urine or red blood cell inside the urine, And the interventions, there's dialysis, the hemodialysis, and the peritoneal dialysis, where the hospital may insert the dialysis catheter to drain out fluids or urine from the patient. Can be done at home or clinic. Then medications, specific medication, I cannot tell the exact generic names, but there's medications for acute kidney injuries, different from chronic kidney injuries. So for acute kidney injury, there's medication to reduce, maybe some sort of pain medication. And it's important to stop using antibiotic that for prevent infection, or NSAID drug like Nurofen, non-steroidal anti-inflammatory drug, and ACE inhibitors. So these 3 types of medication must be stopped if the patient already diagnosed with renal system disorder or acute kidney injuries. And again, the prevention is similar to chronic kidney injuries. Just consult with the nephrologist if already diagnosed with renal anemia or mineral bone disorder. Reduce cholesterol or fat inside the diet for the diet. Reduce the meat and fat. Eat more fruits and vegetables. Control blood pressure, so prevent hypertension, control diabetes or glucose levels, and physical exercise require 150 minutes per day, per week. So then, based on the instruction of physiotherapist, these are the preventions for acute kidney injuries. Any question, please let me know, and thank you for watching. See you in the next one.